And I call the member for Bennelong.
Thank you, Deputy Speaker. In my electorate of Bennelong, just like in many across our country, our community is struggling with the cost of living. In and amongst that, of course, I've had countless constituents approach me to raise their concerns about the increased cost of seeing a doctor, and I understand why. I vividly recall a time when visiting a doctor was free, but now in Bennelong, like most communities, gap fees of $30, $40, $50, even up to $80 have become the norm. In my adult life, seeing a doctor has gone from being free to being $80. In the past decade, the freeze on Medicare rebates imposed by the Liberal National Government has forced doctors to seek alternative means of covering costs, leading to the normalisation and proliferation of gap fees. These fees now place immense strain on families who have already been grappling with the rising cost of living. In that time, we've witnessed the erosion of our healthcare system with increasing out-of-pocket expenses and growing gaps in Medicare medical coverage. And we cannot ignore that nearly 1 million Australians are forced to forego essential health services and medicines every year due to these costs. This is an unacceptable reality and one that the new government is committed to addressing. And our actions, thankfully, speak louder than our words. We are committed to rebuilding general practice, and after 9 years of cuts and neglect by the former government, we are resolute in continuing to make Medicare stronger for all Australians. The historic investments announced in the first 2 Albanese budgets are unparalleled, as we are tripling the bulk billing incentive, the most significant increase in its 40-year history. This move will benefit over 5 million children and their families, along with more than 7 million pensioners and concession card holders, making it easier for them to see a bulk billed GP. This unprecedented increase will provide benefit to an estimated 67,000 people in my electorate of Bennelong. The 23-24 budget has delivered much-needed support, totalling around $6.1 billion into general practice and introducing reforms to empower GPs. This includes the $3.5 billion in bulk billings incentive, which I just mentioned, which will ease the rising cost of living pressures for millions of Australians. Moreover, we are investing in a diverse health workforce with targeted scholarships and incentives to encourage more health workers to serve in regional and rural areas, addressing the healthcare disparities that exist in our regions. A crucial part of our focus is on making medicines cheaper as well, Deputy Speaker, and more accessible for those with ongoing health conditions. From the 1st of September, around 36,000 members of my community in Bennelong and over 6 million Australians across the country will benefit from cheaper medicines with 60-day prescriptions for a range of medicines. This initiative means that individuals with a Medicare card buying those medicines will save up to $180 a year, while concession card holders will save about $43.80 per eligible medicine. It's a significant step forward in relieving the financial burden on households while ensuring that their health needs are met. This measure, combined with the steps we have already taken by reducing the PBS co-payment for anyone with a Medicare card to $30, down from $42, will help put $130 million back into the pocket of hard-working Australians. And I enjoy receiving updates on how much this measure is being taken up by my community in Bennelong. Already, since the announcement of that policy, locals have saved almost $1 million on over 81,000 scripts handed out in Bennelong. The significance of these investments and initiatives cannot be overstated. They're more than just policies. They represent a genuine commitment by this government to fix Medicare after the decade of neglect from those, not those two opposite, but from the opposition. By rebuilding general practice, tripling the bulk billing incentive and making medicines more affordable, we are putting healthcare back within reach of those who need it most. It's not just about addressing immediate needs, it's about investing in our long-term well-being and our population. Our government's commitment to Medicare is unwavering, and we are determined to make healthcare more accessible and more affordable for all Australians, no matter where you live. This is not just about talking, it's about the action that we've delivered now in 2 budgets. Labor created Medicare and will always act in its best interests.